Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Dr. Michelle Jorgensen, Doctor of Dental Surgery, is an internationally recognized author, speaker, and pioneer in holistic dentistry. She founded Total Care Dental and Living Well with Dr. Michelle, offering resources to help people regain their health. After mercury exposure in her dental practice made her ill, she became a board-certified holistic health practitioner and created health-based dentistry, linking oral health to overall wellness. Author of 6 books, including Living Well with Dr. Michelle, she is passionate about teaching and mentoring. A mother and grandmother, she enjoys gardening, cooking, and embracing nature's gifts. I am very excited for this conversation today. So welcome to the show, Dr. Michelle.
Thank you. Thank you for having me.
I haven't had, well, I think I might have had one dentist on here, but nothing as far as holistic dentist. So very excited about this. You have actually coined the term health-based dentistry. So can you explain what this approach entails and how it differs from conventional dentistry, particularly in its connection with overall wellness for women? I think that's important to start off with the difference.
Exactly. So I'm going to give you just a real short version of my story and how I got to where I am.
For sure.
Because that's a big piece of it. So I'm a general dentist, and I thought I would just be practicing dentistry in the way I was trained in school for forever. My father is still practicing in his 70s. He's a dentist as well. And unfortunately, that's not how it went for me. So I started getting really sick at about a decade in. Didn't know what it was. I had really bad stomach issues. I literally couldn't even drink water without pain sometimes. I had brain fog, and people talk about brain fog, but this was to the point that I couldn't complete sentences or remember a patient's name from room to room. And I had such bad numbness in my hands, I couldn't even hold a pen or blow dry my hair or hold my dental instruments anymore. So I actually put my practice for sale because no one could give me any answers, and I didn't know what it was, and I didn't know what to do anymore. So, 30-something-year-old mom of 4, super busy. This was our entire livelihood. This was a really bad place to be in. So eventually, through a lot of searching, found out it was mercury poisoning from drilling fillings out. Not from ones I had, but from drilling fillings out for others, because I was a cosmetic dentist. So I was taking all of that mercury out. Those fillings are 50% mercury. Still are today if they're in your mouth. They're 50% mercury. And all that mercury was released when you drill on it. So I got deathly ill. Had to figure out how I was going to keep doing my job but not get more mercury in. So I found out there was an organization that had protocol for this. I didn't even know it existed. I had been told that mercury was completely safe. It can never make me sick. And if I told someone that it can make them sick, I would lose my license. That was all I'd ever been told about this. So it was definitely a new path. So when I started down this path, patients obviously noticed. When the dentist arrives in, this hazmat suit in the office, they're thinking, something's definitely wrong here. Something's going on. So they started saying, well, that's really interesting. Like, my doctor might be interested in that, or my mom might be interested in that. So people started telling me things that I should look into. They would say, well, do you know what really is going on with fluoride? What's really happening inside of a root canal? Like, I've heard it can make you sick. Is that true? And just all of these questions that I didn't have answers for. So I had to start finding answers. And the only thing I knew to call myself was holistic. So holistic dentistry was kind of the term that everybody had used in this kind of realm. But when you call yourself holistic, people think you're just crazy. Like, everybody thinks that I'm just going to be wearing tie-dye and burning incense and all kinds of crazy stuff. And that's the exact opposite of what I do, actually. I have to support everything I do with science and research, and people will come into my office and they're like, whoa, this is the most technologically advanced dental office we've ever been in. I'm like, yeah. So holistic it just comes with too much baggage. And biological is another word people use. Nobody knows what that means. So finally I just said, you know what? I'm just health-based. Like, I just realized how much dentistry impacts your health. So when I look in your mouth, that's what I'm thinking. How can what I'm seeing here influence your health overall, and vice versa? How can what I see in your mouth, what can it tell me about your health overall? So that's where health-based comes from, is basically my story, and not wanting to be considered crazy, even though I might be, who knows? But I really think it really wasn't that fitting.
I feel you there and there. I mean, it's the same thing in naturopathic medicine. I mean, they think it's, holistic medicine, and I am far from crazy. But I can feel you. I feel you there.
They say that all you talk about are feelings. There's like all you people talk about in your holistic stuff is like feelings. I'm like, what are you talking about?
So funny. So you mentioned when you look in your mouth, you can tell a lot. So what are some common oral health issues that you see in women, and what natural or holistic approaches can be used to address these?
So a lot of things we notice are dry mouth. That's a common one, and it can be related to hormone health. It can be related to a lot of things, as well as gum soreness. So when estrogen decreases in menopausal times, or even in times of hormone fluctuation, it will affect your gums. That's why we have things called pregnancy gingivitis. What is that? It's gum inflammation when your hormones are going crazy during pregnancy. So there's a lot of relationship between that and dry mouth. Well, the dry mouth is really annoying, first of all, when you're trying to, make enough saliva for, your tongue to feel good and your teeth to, and not collect a lot of plaque and a lot of things. So there's a lot of natural remedies for that, actually. First of all, figure out your hormones, which is why they listen to you. But, let's start there. But second of all, there's a lot of natural herbs that can help with this. So marshmallow root is a really great herb. I have it in mouthwash that I formulated. Marshmallow root, calendula is another herb that's great for this. So is xylitol. People don't recognize or understand. Xylitol is really great at turning off bacteria in your mouth. Now, I don't think you should make muffins with xylitol, but if you use it in just a small amount in a tooth care product, it works really well. So then if that dry mouth continues, the thing that I really look for is gum line cavities. So if somebody shows up in my office and they've not really had cavities in the past, or maybe one here or there, but nothing much, but they come and they've got 5 gum line cavities, immediately that tells me that their gut is not functioning properly, because the body has to stay in balance and it needs minerals to be able to take care of your heart and your brain and all these other things. If it doesn't have enough, it will go find minerals. And guess what your teeth are made of? Minerals. So if you don't have enough minerals to do all the essential body functions, your body will find it in your teeth and literally mine them, and it will show up as cavities along the gum line. So those are 2 biggies. So what do you do there? Well, you've got to up your minerals, and you have to add vitamin D3, K2, because that's essential for making sure that those minerals are absorbed. So those are 2 biggies that I see, especially in women, is gum health and low minerals.
Huh. Very fascinating. You can tell a lot from the mouth. Who would have thunk, right?
A lot. Yep.
So besides just the teeth and gums, what are some often overlooked signs in the mouth that might indicate broader health imbalances in women, such as hormone fluctuations or nutrient deficiencies? Are there more?
So nutrient deficiencies for sure is, the cavities. And this is the person too that I see that says, every time I went to the dentist, literally every time since I was a little girl, I've had a cavity. My brother didn't brush his teeth for 5 years, never had a cavity. Why is this happening? That's all about nutrient deficiency. And then people usually start to beat themselves up and say, oh, it's just because I'm not eating well. No, it's not always because you're not eating well. It's usually because you're not digesting well, which has nothing to do with your willpower or anything else. It has to do with your gut, the strength of your gut, basically your digestive power. So we have things that we do like the baking soda test. I don't know if you recommend this for people, where they can see how active is their stomach in digesting nutrients. So if you're getting cavities, and you always are, and you're brushing your teeth, this is minerals. This is not tooth care. This is not what your mom told you. Moms only knew to say brush your teeth more. They didn't know to say, oh, your gut's not working very well. Let's actually get that gut function back, which is probiotics, which is sometimes taking betaine, which is just stomach acid, along with food, so you can actually start to absorb properly. The other one that we see a lot in women that women sometimes don't expect to see is worn teeth in the front. You might think, well, what does this have to do with health at all? Especially if it's just in the front. But honestly, a lot of tooth wear in general relates to not getting enough air when you are asleep. And women think sleep apnea or sleep disturbances are largely for just like overweight old men. It's actually not true. Women of all shapes and sizes actually struggle and suffer with airway problems. And sometimes even the smaller is worse, because a big issue with airway or getting enough air when you're sleeping is space in your mouth. And so if you are smaller framed, sometimes you don't have enough room for teeth, for tongues, for tissue, for everything. You lay down and all that falls back into the space that air is supposed to pass. So some of the signs and symptoms I tell people to look for here is worn teeth, like I'm saying. So if you have worn off teeth, especially in the front, because what your body does is it accommodates for this by bringing your bottom jaw forward like this. It opens up space back here in the airway and it wears your teeth out. The other thing is clenching and grinding. If you are clenching and grinding at night, wake up with headaches, sore muscles. If you wake up and it looks like a tornado hit your bed, your sheets are all over the place, or you just wake up at night. You wake up and you're like, why am I awake? Like it's 2 a.m. What am I doing? Or 3 a.m. or you can't go to sleep at night. So many women suffer from insomnia. A lot of this is due to mouth size problems. If you had braces or need braces, you have crooked teeth. If you had your wisdom teeth out, most likely you don't have enough space in your mouth for everything that needs to fit. So those signs, worn teeth, clenching teeth, everything tell us your body is desperate to try to keep your airway open at night. So it squeezes those muscles. It brings your bottom jaw forward. You turn over so that you can get enough air. All of these things are signs that you are really oxygen starved at night. Nothing works great when your oxygen isn't there.
Yeah. So I'm assuming you have to get that corrected by aligners or braces, correct?
Yes, well, there's a couple of things, actually, options. You're thinking exactly right, because most people think we'll just slap a CPAP on somebody.
Yeah.
Let's just put more air in there.
Right.
Well, the problem with that is that, my best analogy is the mouth is like a garage. And if you have your tongue and teeth and everything, it's like a pickup truck. Well, sometimes the garage is super little and the pickup truck is super big. And it's not that the tongue and teeth are wrong. It's just that the garage is too small. So the end of that pickup truck hangs down into where you're supposed to be breathing. It hangs down in the driveway. Well, if you just put more air down the tube, it's going to run into the back of the pickup truck, no matter what. So this is the CPAP problem. And so many people tell me they gave me a CPAP for my sleep apnea, my sleeping problems, but the mask just blows off my face. Well, it's running into the back of the pickup truck down there. There's no way it can get down to where it's supposed to go. So yes, you got to make the garage bigger. It's exactly what you're saying. We use aligners, we use expanders, but we also can shrink tissue. So we can shrink up the tissue at the back of the throat with a laser. It's a procedure called night laze. That's an option as well. And the other one that a lot of people don't think about is there's swelling in this area, in tonsils and tissue and everything that's blocking off this air due to hidden dental infections. This is a huge one. Hidden dental infections underneath old root canals and where teeth were removed, including wisdom teeth, can often lead to swelling that doesn't allow us to breathe properly. And then you don't sleep, you feel tired, you're fatigued all the time, you just don't feel good because you literally can't get to deep sleep.
How do you know if you have unresolved infections?
Great question. So we use it's called a cone beam CT scan. And one of my very favorite stories that I always like to tell is of a lady, and it's probably been at least 10 years ago. She came in and she had a tooth that had a root canal. And she just kind of tapped it. This is what a lot of people do. They'll just kind of tap it and go, I don't know, it just doesn't feel right. Like it doesn't hurt. It doesn't, it doesn't feel right. So we took a regular dental x-ray, the kind you put in the mouth, take a x-ray. We popped it up on the screen and I said, it looks fine. And if you'd shown it to 10 dentists, they would have all probably said, it looks fine. But I had just gotten my new cone beam CT machine in my office. And what this is it looks a lot like the thing you had when you had braces and it kind of goes around your head, but it's a little different. It takes a 3-dimensional CT scan of your head. It's so incredible. So I took a scan of this lady and I could not believe it when it came up on the screen because that root canal had looked just fine. She had a quarter-size hole eaten in her jawbone from infection at the end of her old root canal tooth, and I could not see it on the dental x-ray. So these are not infections that dentists are ignoring. These are infections that dentists can't see.
But she had no pain?
No, just that. And because you don't. When you have the problem with root canals is they've removed the nerve inside of the tooth. So the early
you can't feel it.
You have no idea. So all there is sometimes this vague feeling of, it just doesn't, I don't know, something's just, and these are always the words, something's just, I don't know, just a little off because that infection is spreading into the bone, into the sinuses. I see so many people who've had numerous sinus surgeries and they still have infection in their sinus and their ENT can't figure it out. They've literally blown out all their turbinates and everything. and they have no idea what's going on. And I take a CT scan and I'm like, it's the upper molar that had a root canal. The infection has literally eaten a hole through the bottom of the sinus floor, and it's the release valve is to spread that infection into the sinus. So the ENT clears it out, cleans everything up. It goes away for about 2 weeks, and then root canal fills it back up. The infection from the root canal fills it back up again. Sinus infections. So you have to get these cone beam CT scans to find infections I'm talking about like this. I can see everything. I can see sinuses. I can see jawbones. I can see everything. I can also see the airway in that cone beam CT scan. I can see is there limited space back there? Is this why you can't breathe? This is what's going on.
Yeah.
That cone beam CT scan is absolutely essential to determine what's exactly going on in the mouth and the head and neck.
Awesome. How does one avoid a root canal?
Well, first of all, figure out what's leading to tooth decay. So I tell people all the time, cavities are not a deficiency of fluoride. And this has been a little bit of a debate lately, and I'm sure you've probably heard some of this debate because this filters right back to you and your world as well.
Yep.
Fluoride does strengthen teeth, but it contributes to low thyroid function. It changes bone density. It leads to lower IQ in children. I mean, there's a brand new research article in January just showing this. So we always used fluoride as the gold standard. But fluoride doesn't stay put. Sure, it strengthens your teeth, but it also changes and affects negatively a lot of other things in the body. So here's the cool thing. Cavities aren't a deficiency of fluoride. They're a deficiency of minerals. Fluoride isn't just naturally occurring in your teeth. Minerals are. So when you look at your teeth and you smile, that enamel, that's actually made of something called hydroxyapatite. So you need to put minerals on the outside, which is hydroxyapatite. You may have heard this word in the dental world these days. So this is what you need to be using in a tooth care product. And you need minerals on the inside. So that's going to be a broad spectrum mineral. I have what's called a tooth and bone formula that we made, along with vitamin D3 and vitamin K2 to actually get those minerals into the cells. So that's starting point is prevent cavities. Just prevent tooth decay. Let's treat them the right way. The second thing is if you have a deep cavity and somebody's told you need a root canal. I see second opinions for this every single day. People say, I was told I need a root canal. First of all, you don't need a root canal because you don't even need your tooth. You can live without your tooth. Then nobody wants to, but you can, right?
Yeah.
There's plenty of people walking around there in the world without teeth. So you don't need your teeth even. So that means you don't need a root canal. So don't let anybody tell you that one, first of all. But there are options. If the tooth is still alive, and how do you know if it's still alive? If you're drinking cold water and, oh man, that's sensitive right there. But then it goes away. If it's just some passing sensitivity, I think I've got a cavity. Man, I want to eat something sugary. Oh, that thing sure lights up. Then it goes. That means your tooth's still alive. That's all good signs right there. If that's the case, the dentist goes and removes the cavity down to the deepest place, but does not uncover the nerve. That's the key. We then use ozone right there to kill all the bugs at that deepest layer, and then we fill right over top of it, leaving the tooth there, keeping the tooth alive. So amazing, and it's possible to do this. If the tooth is already dead, and how do you know if it's already dead? That's when you're going to get the swollen face, the swollen cheek. When you bite on it, it hurts so bad. It's waking you up at night. You're driving down the road. It's killing you. That tooth's already dead. In that scenario, you can choose to do a root canal knowing that you may be setting yourself up for issues down the road, because we didn't even discuss this, but what happens is there's little tubes inside of the tooth, not just the main root canal. There's feeder channels that go throughout the entire tooth, and every dentist knows this. This isn't something I'm making up. We all learned it first year of dental school. Those feeder channels are too small to clean and too small to fill. So what ends up happening is dead tissue stays out in those little feeder channels, no matter what. At the end of the root canal, even if the root canal was perfect, there's still dead stuff in the tooth. Well, if you have dead stuff anywhere in the body, it's going to attract bacteria. Those bacteria congregate around the end of the root, and eventually they start to spread. So this asks your immune system to deal with it 24/7. This is where health problems come. Because when your immune system is distracted, tired, worn out, it's no longer able to take care of other things that come along. So we see such a correlation between autoimmune disease, hormone problems, even things like cancer and heart disease and strokes when people have infected root canal teeth, because your immune system can't take care of you the way it knows how to do if it's taking care of this 24/7. So if you have an infected tooth already, I know this is a little bit against what anybody expects, but you remove and replace the tooth. We can replace your teeth all day long. I used to tell everybody, I would do anything to save your tooth. That's what we were trained as dentists to do. And now I'll say, I'll do anything to save your health, even if it means replacing a tooth, because I can do that. We replace them with ceramic dental implants. It's just like you never lost a tooth. I have a dental implant right here. Nobody knows it. It looks like a tooth. It smiles like a tooth. So that's what you do to prevent it. Basically, you catch it before it gets to the nerve. If you get to the nerve, we're going to remove and replace the tooth.
I want to go back to hydroxyapatite. I never say it. Appetite. That's coming up a lot as far as another controversial substance. And there's nano, non-nano. Can you talk about that? And I think people are kind of, they understand fluoride now, but this new one is another controversial one.
Yep. So first of all, hydroxyapatite is simply what teeth are made of. So it's a mineral complex. So when you smile, it's the thing you're looking at. It's a mineral complex that has calcium, magnesium, a bunch of minerals just put together in a complex. So when you get acid on your teeth, whether that's you drink something acidic like a Coke or an energy drink, it's going to dissolve some of those minerals. Or when bacteria eat sugar, they create acid and they dissolve some of those minerals. It leaves a hole in your tooth, bugs crawl in. So the idea is, and the reality is, if we can plug that hole back up again, we can literally stop cavities. We can stop them from progressing, and we can stop them from even forming in the first place. So the size of the particle has to be small enough to get into the hole. Make sense? These little dentinal tubules is what they're called. They're little, and the spaces around enamel crystals, they're very, very small. So they are nano-sized holes. But here's where the confusion gets even worse. Anything under 100 nanometers is defined as nano. Anything over around 200 or so nanometers is considered micro. So it's still nano-sized, but we can call it non-nano. So keep following me here. Basically, you have to have a size small enough that it's going to be able to get into that tube and plug it to be able to prevent and stop cavities. You can stop cavities. You can reverse cavities. If you can get a piece of hydroxyapatite small enough that it can get into the hole. So you want something in the realm of 50 to 200 nanometers in size to fit into that hole. So now we get into all the controversy. Does this cross the blood-brain barrier? Is this going to build up in other tissues? All of those kinds of things. So a lot of the research was done in cosmetic applications. So things like sunscreens and lotions and face, like foundation. That's where a lot of these nanoparticles were being used. The cool thing about oral care products is that the large bulk of any nano that's going to get into you, first of all, we're going to spit most of it out. When we put lotion on, it's all getting in. When we put it in our mouth as a toothpaste or tooth powder, we're going to spit out, we've done research, we're going to spit out 93% of it. Okay, so 93% of it's going to go down the drain, so you don't have to worry about that. What is the other 7% going to do? About 90% of that is going to get swallowed. There's a tiny little bit that might get through your gums, super teeny tiny amount. The large majority that gets into your body is going to get swallowed. Here's the cool part about stomach acid. It breaks apart mineral complexes. So that 7% that's swallowed is going to get broken apart into calcium, magnesium, phosphate, hydrogen, oxygen, all things that your body knows what to do with. So if we're talking about sunscreen, you don't want to use nanoparticles. There's concern about blood-brain barrier. If you're using it in a tooth care product, you want to use something in this realm of nano. Remember, this is like the bigger side of nano to get into the tooth, but it's going to dissolve in the stomach. And it won't cross blood-brain barrier. It won't congregate in your kidneys. It won't do any of these things because it's just calcium, magnesium, hydrogen, oxygen at that point.
Well, thank you for clearing that up. Makes complete sense.
And I've done a lot of research on this because I've been asked these questions thousands of times. So this is basically what research is showing today.
Yeah, awesome. Thank you. So how can women proactively support their oral microbiome naturally? And why is this so important for overall health?
So it's interesting. We use these words oral microbiome without realizing that the microbiome is top to bottom. It's just a biome that lives in our body. So the mouth is the first part of the digestive tract. So it is part of the gut. It is the first place that food lands, right? It starts to digest there. So really the bugs that are living here are also going to be related to the bugs in your stomach, going to be related to the bugs in your intestines. Like they're all cousins. They're all just living in the same gut tube from top to bottom. And the key is we want to keep the good ones happy, and we don't want to encourage the bad ones, right? So there's a couple of things you can do on a daily basis. Number one is mouthwash. Do not use an alcohol-containing mouthwash, because alcohol, as we know, is a disinfectant. It's going to kill every bug inside. So if you're using a Listerine and that burn, that's high concentration of alcohol. It's killing everything. So not only does it kill bugs in your mouth, leading to bacterial overgrowth, more bad breath, more dry mouth, all the above, it's also going to kill bugs in your gut, because remember, you're swallowing 7% of that. So now you're dousing yourself with alcohol every day without realizing it. So that's throwing off your entire microbiome. So if you're going to use mouthwash, you're not going to use an alcohol-containing one. I have a great one that's based with colloidal silver. Colloidal silver, has a whole bunch of great herbals. Look for something that does not have any alcohol in it if you're going to use a mouthwash. Mine Gum Health mouthwash also has a probiotic, because that's the second level of thing you're going to do, is you're going to introduce good probiotics. Actually, it's a prebiotic. It grows, it feeds good bugs, and it kills bad bugs. Prebiotics are fabulous. Where can you get them? A lot of dental care products, a lot of mints, those kinds of things, you're going to be able to find them now. But a super simple way to do it is oil pulling. A lot of people have heard of oil pulling. This is an old Indian technique. You put a tablespoon of oil in your mouth, you swish it around. What are you doing? The oil is attracting bugs from everywhere, pulling them into that oil. So you're going to spit that out after about 10 minutes, and you're spitting out a whole bunch of bad bugs, also some good bugs. So I don't like to do oil pulling every day. I only like it about every 3 to 4 days, because you want some of those bugs to stay put. The other one is tongue scraping. So people don't realize the tongue is like a shag carpet. So a lot of those bad bugs are going to live there. And if anybody has bad breath, geographic tongue, any of those things, that's a sign that your tongue needs some scraping. Anybody's tongue needs scraping. So you're going to brush your teeth, floss if you floss. That's actually another controversial thing. Tongue scrape, and then mouthwash, because I want everything out plaque-wise. That's going to be off your teeth and off your tongue before you're then going to mouthwash, because you're going to get those good herbals and things into the tongue at that point. But those are really great things to help keep all the good bugs happy. Oil pulling, tongue scraping, really being conscious of your mouthwash.
Yeah, easy things. You all can do it. Well,
Absolutely.
You have a new book out called Living Well with Dr. Michelle. So touch a little bit about this. This is your 6th book? Yay.
Yep. Exactly. 6th book, but first one that's actually been traditionally published. The other 5 were self-published. So this has been a whole new journey. Really, this book, I've told my story so often about how I got sick, but a lot of people just kept asking, well, how did you get well? And this book is not my story. It's not my memoir, but it's really the foundation of that, because in today's world, we are not lacking in information, right? I mean, there are so many podcasts. I mean, here we are, we're on podcasts right now. There's so much great information out there, but a lot of information can lead to a lot of overwhelm. And that's what I find a lot of people are in right now. It's just in this place of overwhelm. So they say, well, I get it. Like, I want to do something different. I want to change. I want to make changes. I want to do, things that are going to help, but I have no clue where to start. And psychologically, you actually can't move forward if you're confused. This is proven. This is a proven fact. If you're confused, you can't take a step forward. So what this book is it's all about teaching you how your body really works. And it's not about which kind of medicine is better. Like, is modern medicine better, or is naturopathic medicine better, or is traditional medicine? Like, that's the wrong question. The right question is actually, what do my cells need to be well? What do I need to be well? What do my literal cells that make me up, what do they need to be well? And what I have is an assessment in there that's taken from all kinds of traditional medicine across the world. And you plug in your symptoms and say, yes, I have this, I have this, I have this. And it tells you which cells need help first. So that's the beginning of chapter 10. It tells you which cells need help. So let's say you plug in your symptoms and it says your liver and gallbladder need help first. Now, all of a sudden, you've cut through a ton of the confusion, a ton of the overwhelm. You said, oh, okay, my liver and gallbladder need help first. Got it. Okay, I'm going to go there. Then in the next chapters after that, I tell you what your liver and gallbladder need. And what I do is I focus on things you can find from the earth. from literally the earth, from water, from air, from just the things that are surrounding you naturally. This is not to sell a whole bunch more supplements or anything like that. This is saying your body has the ability to be well if you simply learn how to interpret what it's telling you. And those symptoms are your cell signals. Mm-hmm. So this is your translator. This is your translator for your cells to say, oh, that's what you've been trying to tell me. Got it. Now I need to do this. So it's just a way to cut through the confusion and lead to that energy that everybody wants to be able to do what they want in life.
Love that. Thank you for writing this. I'm excited to dive in. I just got it. I was out on vacation and the box was there waiting for me in the office. So I'm excited to dive in. Well, Dr. Michelle, we could probably talk for a million more hours about everything, oral microbiome, dentistry, everything. But I'm going to wrap it up with one final question I ask all of my podcast guests. What would be your best or favorite health tip that you could share with the audience?
So I love to talk about grounding or earthing because it's free. You literally can walk out of your door right now, and what the earth does is it's a huge bank of electrons, and your body is powered up. Just like your phone is powered up, you go plug it in. Well, how do you plug in your body? You go walk on the earth. So tonight, everybody who's listening to this, go take your shoes off. Go put your feet on the earth for literally 10 minutes, and you're going to find that you've just now been powered up more. Yeah,
except in Arizona, make sure you're in the shade because it's hot.
It's so hot. I have family in Arizona. It's like 117 degrees there. Don't go there. Don't go outside unless it's in the shade. Yes.
Just in the shade. Just in the shade. Well, Dr. Michelle, thank you so much for being on the show. We'll make sure that we have all of her information linked in the show notes. Her dentistry products and how I really got connected with Dr. Michelle was through Just Ingredients because they formulated the tooth powder, the mouthwash, all of the things together with Carlin. So it's so exciting. And her products are wonderful. They taste good and they're healthy for you. So we'll make sure we have all of that linked. And again, I really appreciate your time and being on the show.
Thank you.
And that's a wrap. We'll see everyone again next week. Thank you so much for listening. Make sure to like, share, subscribe, and leave a comment below. And if you haven't done so, please be sure to give us a rating on your favorite podcast platform. Join us weekly as we inspire you to be your best version. For more, follow me on Instagram at dr.erinellis. Until next week, you got this.